I welcome you, friends, to this presentation about the scourge of COVID-19. My name is Dinah Covid, and I would like us to look at what it is. Coronavirus disease 2019 is what is shortened as COVID-19. What is COVID-19? COVID-19 is a type of coronaviruses, one of the infectious diseases that have come up. Coronaviruses are a large family of viruses that cause symptoms ranging from the common cold to more serious illnesses. And they have different forms. Sometime back we had the Middle East Respiratory Syndrome, which was called as MERS. And then we also go to the Severe Acute Respiratory Syndrome, also called SARS. And COVID-19 is a new type of that category. What are the signs and symptoms of COVID-19? We have respiratory symptoms not limited to fevers, which are actually high, cough, shortness of breath as it gets advanced. Sometimes it gets severe and then we get pneumonia. And sometimes we even get severe acute respiratory syndrome, which may result in death as somebody gets congested within their chest. How can we prevent COVID-19? Whereas it is dangerous and it can be fatal, it can be prevented by the frequent washing of hands when we clean our hands, using alcohol-based hand rub, which is sometimes called sanitizers. But in the absence of that, we can as well use soap and water. They can suffice. We need also to apply the wearing of masks. It's important that we cover ourselves with masks. And as we move to join other people elsewhere, to people that can use the masks. As if that is not enough, we also need to avoid close contacts with other people because they can be suspect them as carriers. So we need to maintain social distance from one person to the next, especially as we move to congested places. And also avoid touching our mouth, the eyes, and the nose, because it penetrates through the body through those soft areas. So we need to guard against that. It will be important to prevent it by guarding our bodies and through good dieting, taking lots of fruits, fresh foods and grain instead of the junk food to be very good so that we build on the immunity. But also, it is important that you get vaccinated such that when we are exposed to it, we don't suffer seriously. So vaccination is another form of preventing serious attacks once attacked. It would be ideal for somebody when you're suspecting exposure to go for a checkup, get a medical person to do the checkup. And also, if you have developed a cough and sneezing, please cover your mouth, either using a flexed elbow or using disposable tissue so that once you use it, you dispose it off to avoid contaminating other areas. If you have got it, what do we do? You need to do the treatment. While it has no specific cure, take the prescribed drugs religiously for the symptoms that have developed. You should also take plenty of soft fluids, like tea, it's better you take them warm, and juice. Get enough rest so that you improve on the immunity and the strength of the body. Do some exercises. If you do some exercise, at least you keep the body going strong. And also get enough vitamin D. You know, you get this from the sun. Take care. COVID is real. It is real.